about us. Think about you leaving.
Hello. What's going on, everybody? Let's see. Let's see if I'm live on Instagram. It feels like I'm not, and I don't know why. Hello, Roel. I see you. Who can see me? I'm on YouTube, I feel like, and Instagram for some reason. Lisa, what's up? All right, I feel like I'm getting there. I need to fix the Instagram thing. For some reason, I can't see Instagram. That's the problem. Hello. What's up? All right, it's saying I'm not live on Instagram. TK, what's up? Thank you, brother. Thank you. Let's see. I'm going to have to figure out the Instagram thing. I'm not live there. I feel like maybe Instagram just went down. I hope everybody's doing wonderful this evening. We're going to be with Doc tonight. He is on vacay, but he was kind enough to say, Ben, I want to hang out a bit. And so that's what we're doing. D. Lynn, hello. Alice, hello. Great to see everybody. Thank y'all for being here. Thank you for being here. Is my feed okay? Am I I know it's an Instagram problem. Okay. All right. Can you guys see me okay? Any delay? I don't know why there would be a delay, but it feels like there is. I'm adjusting everything. Ivy and JC with Ivy, what's up? Okay, thank you. Thank you, Alice. Okay, good. As long as you guys can see me, that's all that matters. All right, we're going to bring Doc here soon. Thank you, D. Lynn. I think we are rocking and rolling. All right, we're going to get Doc here in just a second. Real quick, I'm going to put this up. If y'all aren't signed up for Performance Weekly, sign up for Performance Weekly. All of our best stuff every single week goes out Tuesday at 3. Today we highlighted an episode in the Common Sense MD with Dr. Michael Wilkinson. If I can pull this up, there we go. Oh, well, there we go. That is Dr. Wilkinson right there. With Spine and Pain Associates, a different way to think about chronic pain. He does a fantastic job of talking about what it is that he does. I encourage everybody to watch this. It applies to everybody. The way he goes about pain is just so interesting to me, and he did a great job of explaining his process, and I thought Doc did a great job with the interview. Brand new episode of Common Sense MD is out now. You can find that everywhere, YouTube, all the audios. It is up. And then we had a brand new episode of Explain That, the star of the show, Robin Riddle, talks about diminished ovarian reserve, DOR, something that everybody interested in fertility needs to know about. Huge shout out to Robin for doing this episode and explaining what DOR is. If this isn't kind of in that season for you, I'm sure you know somebody who is in that season. Share with them that episode of Explain This, talking about diminished ovarian reserve. Let's see here. Edna, what's up? Great to see you. Thank you. Thank you, Roel, for that. I thought it was a really good episode with Dr. Wilkinson. He's actually an Oak Ridge native. Like myself, I grew up in Oak Ridge, and that's where he's from, and he's in the Tri-Cities and has been the Tri-Cities for over a decade now, I believe. All right, let's see here. We're going to get Doc on the show here shortly. And I might try to, I don't think I'm going to be able to get on Instagram. I might have to not do Instagram tonight. Let's see. I might have to put that on my story here soon so we can let everybody know that we're here. Okay, cool. Cool. What's up?
Ben, we're not together tonight.
I know. I have a feeling you're in a more fun place. Is that true?
Yeah, for sure. I'm at the beach. I'm at Delray Beach, Florida, which is South Florida, and I've been down here for a little bit. I come down every year in February for a couple weeks and study longevity medicine. This is kind of the hub of it in the United States. That's where Life Extension is. It's where A4M is headquartered, and there's a lot of docs down here that I consult with about longevity techniques and biohacking. So yeah, I'm into it.
I think that's super cool. And you got a great I guess a recording tomorrow that you're going to do talking a little bit about salt, which I'm excited to hear when it comes out. But anything kind of stand out? I know last year you were really noticing posture, and I know you did a lot of reflecting on how you want to age. And I know one of those things for you is like you don't want to be hunched over.
I've been practicing Tai Chi walking down here. Okay. I've gotten a few stares, because of it. It looks weird. If anybody's Tai Chi walking, it's kind of like walking on thin ice, very carefully, very slow movements. I'm trying to get into Tai Chi a little bit.
And can you explain why?
Muscle. Well, as you get older, you lose a little bit of proprioception, and you don't need to be, bench pressing 250 pounds and killing it in the gym. It's been proven that maybe less is even more, especially when you're not trying to really bulk up too much or, trying to lift heavy weights. At my age, you're trying to avoid getting hurt while maintaining your muscle endurance and posture, balance, and those type of things. So I think Tai Chi is great for that.
That's super interesting. I know that you have talked a lot about this being the year for you that you get into Tai Chi, and I'm kind of fascinated to watch that journey. And we've already got a few videos of you doing the walking. We won't post them on this live show, but we will once it goes through the editing process.
I do like to watch people. I'm a people watcher, and I like to watch people walk because down here you get a good mix of older people and younger people, and you can just see the forward head posture with most older people and kind of hunchback. You can even kind of pick out people that you think may have early Parkinson's disease. So that's interesting. So I'm having a great time, though. The weather is certainly beautiful, wonderful. That's why I picked February to come down here, is because of the weather. And you've been having some terrible weather where you are.
Yeah. Today was actually one of the better days. I see you, Carter. It was so good to see you today. I'm going to put this up from Carter. We're looking forward to you being home, Pop. We'll hopefully see you here in the next couple days as you get back here. But the team's doing an amazing job of keeping the ship going. Thank you, team. I see Shelly's question. Thank you, Shelby, for that question around berberine. We're going to get that up here in just a second. But I appreciate you taking the time out to do this with me while you're on vacation, and we'll have a little catch up time too. It's just good to see your face.
Yeah. I hope my dogs are doing well.
Is that the only reason you're doing the show with me tonight? Is just to make sure, like, hey, are the dogs okay?
I would like to see him.
Hopefully we can get him on the show. If I have see if I'll get him up here once we answer a few questions. I'm going to go ahead and get started with this with a question that came through email, Doc, if that's okay. This came in shortly ago, and then I got one more I'm going to have to read because I didn't have time to put it in here. First one is, could you discuss Grover's skin disease and what can be done for it? Is it considered an autoimmune disease, and is it very common?
It's not real common. I've only seen it in my practice a few times, and it's probably seen me more. But I have seen a couple cases of it that was pretty gnarly looking. It usually occurs. It's red, itchy red bumps that occur mostly on the skin and the back, and it's usually in older men, if I recall. Although I think it could hit anybody. That's the big question: is it an autoimmune disease? Nobody really knows what causes it, but it seems to be precipitated by sweat and sunshine. People that have had a lot of sun damage to their skins. The ones I've seen have been that way. Again, I'm not a dermatologist, and I think it does take a dermatologist to try to biopsy it to come up with that diagnosis. But it's not real common. It's probably more common than we think it is, but we certainly don't see it coming in our office very much. I need to get one of the derms on here to talk about that someday. I've got a plan for one of the dermatologists to come on a podcast with me. But in general, you treat it with topical steroids and maybe also use some, medications like antihistamines, like Zyrtec. If it got severe, you might use a short course of prednisone. Some people have used, I'm trying to recall, I'm pretty sure some people even use Accutane for it, because those blisters can get pretty rough. It's not acne, but it can get blistery and red. And unlike acne, which has pustules, it doesn't itch, it more hurts. This itches more. But it's usually limited to the trunk and the chest, doesn't get on the face or legs too much. And it's precipitated by something, whether it be sweat or too much sun. Nobody really knows. I suspect there may be some kind of autoimmune predisposition to it, because it seems like your body's reacting against itself in a way. Maybe your own sweat. So I hope that helps. It's one of those I don't see a lot of, though, to be honest. Probably
super interesting. Thank you for that question that came through email. We're going to keep moving here so we can get to the live portion of the show. I'm going to read this. It just came up on email, and I didn't have time to put it in the banners there. So bear with me, guys. The question is, oncology has recommended chemo for prostate cancer that has spread to a couple of lymph nodes and yet to be determined, possibly a lung. What types of chemo are used for this? And could you please discuss them briefly and your thoughts if used in combo with integrative treatments as well? And then it goes to say, also, is there something you can take to reduce testosterone without causing castration type doses to maintain a reasonable level, but which has presently spiked, possibly due to the cancer? And Doc, if you need me to clarify anything, I can. What's your thoughts on this?
Well, metastatic prostate cancer, it usually goes to bone, but in this case, it seems like it's gone to lymph nodes and possibly the lung, which it can. Certainly, chemotherapy is used for metastatic prostate cancer, but usually when hormonal deprivation therapy has failed, like agents that we use like Lupron, which unfortunately cuts your testosterone level way, way back. I don't know of any hormonal deprivation treatment that is just going to kind of reduce it halfway. I don't know why the testosterone would be spiking in your case. But when hormonal therapy, anti-testosterone therapy, which has a lot of side effects, a lot of people can't tolerate it because you get hot flashes. It can increase a lot of problems cardiovascularly. But if hormonal therapy doesn't work, again, that's usually preceded by surgery, possibly radiation therapy, and then hormonal therapy. If hormonal therapy fails, they use chemotherapy. And don't quote me on this because I'm not an oncologist, but I think they use platinum-based type of chemotherapy. There's some new stuff they're doing up at Harvard. I know that. Some immunologic type treatments. I think if I had that, I would probably go to one of the research centers to get that treated if you're in the local area. I know Harvard's doing a real good job with it now. I have a friend who went up there fairly recently for treatment for metastatic prostate cancer to bone. But and his treatment mainly involved more precision radiotherapy. But in any event, I don't know if, natural ways to lower your testosterone level, things you typically, unless you had this, wouldn't want to do, like increase your amount of soy, which is more estrogenic, and some people think that would displace testosterone from the receptor sites. But certainly, it'd be interesting to see what the dihydrotestosterone level was. And in that case, sometimes we'll use things like DHT blockers, whether it be natural like saw palmetto, stinging nettle root, pumpkin seed, and some of those. You could always think about using finasteride or dutasteride, which bring down DHT levels. It'd be interesting. Although I don't think it's a real common treatment for that. Of course, in addition to the traditional type treatments, I would definitely pursue adjunctive treatments as well, like fenbendazole, ivermectin, high dose IV vitamin C, ketogenic diet, vitamin D, possibly mistletoe. Some of the alternative treatments I would definitely be getting on board. I had one patient who initially came to me with metastatic prostate cancer a couple of years ago with a PSA level of over 2,000, and with IV, and he didn't want treatment, didn't want traditional treatment at all. And with IV vitamin C, along with some other alternative treatments, his PSA went down to 2, but certainly didn't go to 0. But anyway, those are some of the things you can think about. So definitely get in a place where that they kind of are more advanced in the treatment of that than they are certainly around our area, is what I would recommend to you. But I would pursue both treatments. It's not fun to have a low testosterone level for sure, but I've known plenty of guys that did just fine with it.
It's a really great question, and I will certainly be thinking about your friend. So thank you for sending that in through email, Doc. Thank you for that answer. We're going to get to the live portion of the show here, guys, in just a second. I see Rachel's in here, Angie. I know. See, the team misses you, Doc. The team misses you.
I miss everybody.
I see Tracy's in here. Tracy, what's going on? Great to see you. Thank you for being here tonight. I see Melissa's question. I see Amber on YouTube. Thank you so much. Jack, welcome in, brother. Great to see you, as always. We're going to be taking live questions. So if you have a question for Doc, go ahead and put it in the comments. Let's see where we are at. If I can find first one here. Thank you, guys. See James's question, and then I'll get to Shelly. Thank you, James. Can you address a longtime statin user, the possibility of getting off them with Kyolic? What's your thoughts on this?
It's not going to be like a statin for sure. Some of again, a lot of people get put on statins without really needing a statin. I haven't used colic for that, to be honest with you. I don't worry so much about the cholesterol total levels like a lot of doctors do. But certainly you have a new line of drugs. One of them is called Repatha. And this line of drugs, PCSK9 drugs like Repatha, or kind of the newer way to treat it. And hopefully they're going to come out with an oral form, but they've been injectable, and you need to go to somebody that does this in their office. But you don't get the side effects that you do with the statins, and certainly they're more potent. If you look up the indications for them, they say for use along with the statin. But for people that don't want a statin, certainly they're way more powerful at bringing your levels down. Not doing those type of treatments in my office, I can't tell you too much about the side effects from them, but they're supposed to be less than statin drugs, which can cause a lot of problems, as you know. So you can consider that. The natural ways, we use a lot of berberine, use a lot of hawthorn, aged garlic, and that type thing. But again, if you have known heart disease, if you've had a stent or bypass, or you have a lot of endothelial problems besides taking an aspirin, you may want something to tampen down the inflammation there. Again, it's not the cholesterol that causes the problem; it's the inflammation and insulin resistance that causes the real problem. So, you got to assess why you got started on it in the first place. Most doctors really will put most of their patients on a statin. Most adults, they would want you to be on a statin. But I'm not a big fan of putting everybody on a statin. Sometimes I use them, but real discriminately. So I hope that helps.
James, thank you for that question. I hope that is helpful. I want to get to Shelly really quick on Facebook here. Shelly, thank you for being patient with me. Dihydroberberine and Zepbound can both be taken together. Do they have a lot of the same benefits?
Yeah, they can be taken together for sure. Dihydroberberine is really more like metformin. It really kind of works on your insulin resistance, makes you more sensitive to insulin, which you want. And Zepbound works to mimic the hormones in your gut that tell you you're full, and delays gastric emptying, hits the appetite center, and also decreases output of sugar from the liver. They're called GLP-1 GIPs. That's what Zepbound is. In contrast to a single GLP-1 like Ozempic or Wegovy. But certainly those two can be taken together. If you're a diabetic, then you have to watch out for low blood sugars. That's the one warning I would give you. But I think dihydroberberine is effective without the side effects as metformin is. So there are two different mechanisms. Certainly watch out for low blood sugars if you're using them together. That's the main warning I would give you. Having taken care of thousands of diabetics and growing up with two diabetic kids, I can tell you a lot about hypoglycemia. It's not fun. can be dangerous too, especially if you're driving.
Mm.
So overall benefits, yeah, they're both beneficial overall for your endothelial health, which combats metabolic syndrome, which most Americans are dealing with right now. So those are two great drugs, if you want to call them that, for metabolic syndrome. One's natural, the other one is mimics a natural gut hormone, but it's a prescription medicine. So hope that helps.
Shelly, great question. Thank you so much for letting us talk about the dihydroberberine and the GLP-1s. I want to put this up. Bry's in here. Bryson misses you, man.
Bryson, he's probably pumping iron right now, isn't he?
He's lifting. You know he is. He's lifting. Bryson's
already got a pump on.
It's great to see you, brother. I see you, David. We're going to get to your question here, Dr. Merrill, in just a second. Anytime Dr. O'Rourke comes in, the question, I love that. I love that. We're going to get to Dr. Merrill here in just a second. Let's get to D. Lynn's question. Is there a supplement that helps with neuropathy in the feet, numbness, and pain in the heel area?
Traditionally, vitamin B6 can be used for foot neuropathies. You got to get the right dose, because if you take too much of it, over 100 milligrams, then it makes it worse. So there's a sweet spot between 50 and 100 milligrams of it. So that'd be the one supplement that I use. There are others out there, but I haven't found them to be that helpful. The most helpful thing is to try to find out what's causing it in the first place. A lot of times it's metabolic syndrome, diabetes, or prediabetes, just like we talked about. But there's a lot of investigational drugs out there. Certainly, the medicines that we traditionally use in medicine are like gabapentin or Lyrica certainly have their side effects, and there's a lot of recent evidence that they may cause a little bit of dementia. And if you've ever taken those, you'll notice your short-term memory gets worse while you're on them. There's no doubt in my mind about it. They work, but they definitely have their side effects, plus drowsiness and weight gain. So, those are traditionally the ones that are used. But I like the acupuncture for that. I know Scott Fitzpatrick does a lot of work with that, and seems to help a lot. If you want to looking at a natural way to do it, talk to Scott Fitzpatrick, and see a guy like Dave Merrill, see one of the chiropractors that knows what they're doing. That, because sometimes it can take an adjustment. You may have pinched nerves back there. I'm certainly a big believer in that. So try to always find, the reason for your neuropathy, whether it be metabolic or musculoskeletal, impingement, that type of thing. So hope that helps.
D-Lynn, thank you so much for being here as always, and thank you for that thoughtful question. I want to get this from Melissa here. Thank you, Melissa, for being with us. I currently am without a PCP due to recent issues at State of Franklin. I recently saw an MP in the group who did a heart panel and prescribed ezetimibe, 10 milligrams, due to high cholesterol. I'm unable to take statins. What are your thoughts about this medication? Is in your opinion, is this a good option, or do you have a better preference? What's your thoughts on this for Melissa?
That drug is called Zetia, and it's not a statin. It's certainly not going to work as well as a statin in lowering your cholesterol. But again, you might not even need it in the first place. I don't know what your CT calcium score looks like. I don't know if you take an 81 milligram aspirin, which you probably should, unless you've got some contraindication to it. But so don't freak out about a high cholesterol in the first place. Look at the other metabolic markers, like come in and get a Cleveland heart panel. Look at your inflammatory markers, your insulin resistance, and don't just think you have to have something to bring your cholesterol down. If you're one of those people that have type 2 familial hypercholesterolemia, and your cholesterol is 300 because of family history, it's not a bad one. It's not a whole lot more potent, to be honest with you, than berberine or some of those, or fiber. Something like cholestyramine is another option for you, and certainly the PCSK9 inhibitors, like I just talked about, Repatha, certainly more potent than a statin with less side effects. As soon as they come out with a pill form of that, hopefully they'll just get rid of the statins. But we'll see. We'll see. So those are some things you can do. First thing is, just don't freak out. Get a Cleveland, look at the size of your particles and your other, risk factors for endothelial dysfunction.
Thank you, Melissa, for being with us and asking that question. Thank you for being with us. All right, let's keep going here. Thank you guys for all these awesome comments and questions. We love you. Let's get to Amber. Would it be safe to consume nano silver if having an upcoming CT scan? Also, what are your thoughts on RSO for cancer?
RSO. I don't know why I'm blanking out on that.
Amber, can you give us some context with RSO if you're still with us? If you're still with us live?
Maybe he's on vacation. It's not coming.
He's got vacation brain.
Nano silver, I would check with the radiologist if you're having a contrast CT scan, and sometimes you do want to avoid certain metals. Certainly you want to avoid metformin, which can affect, which we just talked about, if you're on that, which can affect contrast radiologically. But so I don't know, I'd probably ask them. I doubt it has a whole lot of effect on it, to be honest with you. But again, it wouldn't hurt you to stop it for a week or two beforehand. But RSO, I don't know why that's not coming to me. So if you can delineate that a little further, we'll come back to it if you want.
Amber, I'll be on the lookout for some context there. I apologize. We need to do that. But we're going to keep moving, keep it going until I see your...
For treating infections. I think it's really good.
What's that?
I do like silver for treating infections, especially in the sprays. I think they work really well.
All right, let's keep going. Thank you, guys. Let's see where I am. I'll put this up from Tams. A lot of statin comments. I appreciate you guys. That's not super surprising about the insurance companies with that. Thank you, Tams, for the comment. I'll put this up from Dr. Merrill.
Doesn't surprise me.
Talking about Dr. O'Rourke, who's been on the podcast and is a cardiologist, as a little more holistic. And you guys know we appreciate that. So thank you, Dr. Merrill, for the comment here and being with us tonight. Let's get to Candy here. Did you say that methylene blue is a daily supplement or weekly?
Daily. I certainly take it every day.
Reminds me, I did not take mine today, and that is one that you don't want to take at night. Everybody, you want to take that earlier.
It hurts you. It kind of gives you energy, so you want to sleep well at night. I was just wondering. I meant to text Ben Curtis this little text, because did you hear about what happened at Milligan College?
I did. Yeah.
There were 300 people that went to the hospital for carbon monoxide poisoning. And the treatment every ER doc knows to reverse carbon monoxide poisoning is methylene blue. So I need to text him and see if he was telling people about that, because I bet his fellow students didn't know a thing about it. I bet he's very familiar with it. But I wonder how much methylene blue they gave out during that carbon monoxide poisoning Milligan College. Again, I don't think anybody had died from it or anything, but certainly it is a life-saving drug indicated for that and cyanide poisoning.
I do think I think it was a lot of the athletes that I know there's like 250 people. It was quite a bit. And I know Ben Curtis knows all about methylene blue. So hopefully he was around to help.
It
If
saved
he
a lot of
wasn't,
lives.
if you
Yeah, you may get the presidential award for that if you did. I need to call him.
All right, let's keep going. Thank you guys for the questions. Let's see. Let's get to Lisa here, and then we'll go to I see D. Lynn. Having quite a bit of lymph node tenderness, bilateral neck, and also in the right armpit, pushing against the side of the right breast. Previously had thyroid cancer with total thyrectomy and partial parathyroidectomy. Any ideas of the cause, and should it just be ignored? What's your thoughts on this for Lisa here?
Yeah, it has a cause and it definitely should not be ignored. Certainly, you have to look at it and see if it's a short-term infection from, say, a sinus infection or throat infection, dental infection, ear infection, scalp infection. All those things can cause neck lymphadenopathy. If it's not that, it doesn't go away. You need to biopsy it and just see what it is. I know you've had quite a few things go on with you in the last, this past year. So, it's hard to say, but it's something definitely you don't want to ignore because it usually means some kind of infection has been going on.
Lisa, we're thinking about you. Thank you, as always, for being with us tonight. We love you. And we're gonna keep going here. Thank you guys for these questions. I see Joe Ruff. Amber's got some clarification. Put simply, RSO is an oil derived from cannabis. Okay, interesting.
Yeah, that's exactly right. I don't have any experience with using it, to be honest with you.
And that's RSO for cancer is what Amber is talking about. Okay.
I know, CBD, we usually recommend CBD oil for all our cancer patients, and maybe that's the reason. This probably is the reason, unless you're talking about the effects of THC. But we recommend all, or most. I won't ever say all that get on CBD oil as an alternative adjunctive treatment for cancer.
Thank you, Amber, for clarifying that for us. Let's go to Joe Ruff. What is your opinion on spironolactone and ketoconazole shampoo for female pattern hair loss?
Yeah, I recommend both of them. Spironolactone is a DHT blocker, which we put a lot of it. We use it for acne. We use it it is a diuretic, but it's potassium sparing diuretic. But we use it for a lot of reasons. Sometimes we even use it heart failure. Like I said, it's a mild diuretic, but we use it a lot for PCOS, where you usually get high testosterone level, which leads me back to that first question we got tonight. That may be an adjunctive medicine you could use to bring the testosterone level down without using blockers in the question about metastatic prostate cancer. Ketoconazole shampoo is one of those antifungal type shampoos that I recommend for anybody that has thinning hair. They should use either that or Nizoral shampoo a couple times a week because it really kind of opens up the pores in the scalp and allows circulation. So that's one of the strategies we use for hair thinning, in addition to other things you can do like finasteride, minoxidil, spironolactone. They all have their place. So it's a great question.
Thank you, Joe Ruff, for that question. I see Craig is here on Facebook. Thank you, Craig. What are your thoughts on BCP 157 or BPC 157? Legit or quackery? A coworker was gushing over it and make it sound amazing for muscle and tendon injuries.
Yeah, I think it's great. I use it. There's an oral form. It's really one of the few oral peptides that works really well, and it's really good for your gut as well. I found, in using both the injectable form and the oral form, that the injectable form for muscular tendon ligament injuries works a lot better. I do like it a lot. A lot of times I use it in combination with other peptides as well, especially along with TB500. And you can get them that are already mixed together. Some people believe you should do them separately. I think the mixture is okay. When you do have an injury, you can use this thing called a Wolverine stack, which is BPC 157 plus TB500, and inject it subcutaneously near the injury. And in a lot of cases, I've seen pretty amazing results. So I like it. I like it a lot.
Craig, thank you so much for that question. Let's see here. I saw D. Lynn had one. If I can find it again. There we go. President Trump is lowering the price of some medications. The weight loss drugs are on that list. Is one of those better than the other, or are they equal? I'm assuming Dylan's talking about the GLP-1s and the GIPs. What's your thoughts on this?
Yeah, I think in almost every trial, and certainly with a lot of experience in prescribing these things, I think the combination GLP-1 GIP, like Zepbound, beats out just the GLP-1s like Wegovy. So although I've had a couple people that the opposite, they lost more weight on the Wegovy, which now has pill form. But certainly I think the Zepbound has less side effects and a little more efficacious with weight loss. And I certainly hope that they do lower the price of them. That's been the problem, is obtaining them for patients.
Yeah.
So yeah, I mean, I'm hoping so. I really am hopeful that the price will come down on those, because the side effects are just the good benefits of those are amazing. Matter of fact, I was thinking today about them, and I really think that there's a few medical discoveries that come into play every few decades, and that's certainly one of them, in my opinion, along with a drug like insulin. Certainly, I mean, when you compare these things to statins, there's no comparison in the way they protect your heart. They reverse insulin resistance. They just have so many protective effects. They protect your kidneys. So I do truly think that it's one of those discoveries that is up there with some of the other greats that we've discovered in decades past, like penicillin and things like that. So that's what I think about it.
Thank you so much for that question, D. Lynn. I see Tabitha's in here. Tabitha misses you, Doc. Thank you, Tabitha, for being here as always. Holly, yes, he did. That's so sweet. It's so good to see you, Holly. Thank you for being here tonight. I love you. Yes, he did. All right, let's keep moving here. Let's see if I'm missing anybody. If you have a question and I missed you, put it at the end for me so I can easily find it. I don't want to skip any questions tonight. We're going to be here for a few more minutes, and we're going to let Doc get on his way. I see Jeff's in here. Jeff, so good to see you. Thank you for being here tonight.
Yeah, he's a great songwriter.
I think
he may definitely go down as one of the all-time great songwriters. I mean, he does a great Cash, but he may have found his true gift with songwriting. You got to work that song into this.
I know.
On the test.
It's going to be.
Right. What about the infringement rights? I don't know. We'll have to get his permission first.
We'll have to figure out something, but it definitely needs to be the theme song for all of our content. I think it has to be for everything.
Hope you're doing well, Jeff. Thanks for everything you do.
Jeff, thank you for being here. All right, I see Danny's question. Thank you, Danny. Yep, there we go. Thank you, team. My 15-year-old son has a high bilirubin reading done. I hope I pronounced that right. Bilirubin reading done on an ultrasound. It showed he had a enlarged liver and spleen. Any doubts on it? Some suggest Gilbert syndrome. I hope I didn't botch that for you, Danny. What's your thoughts on this for
bilirubin? Bilirubin. Usually Gilbert syndrome. I prefer the French pronunciation of that.
There we go.
If you're from East Tennessee, you'll say Gilbert. I say Gilbert. Talk about that French, experience. I took French. But usually Gilbert's is a totally benign condition. You just need to know about it because your bilirubin is going to be the only thing that's high on that liver function panel. All the rest of the transaminases and all the rest of the liver function tests are normal and doesn't mean anything. Actually, it may have some protective effects, but I don't know why your liver and spleen are enlarged on that ultrasound. I don't know. You need to get an opinion on that from somebody that is probably just a GI specialist. I don't know. Like I say, I can't tell you this for 100%, but most of the time when I see that, it's Gilbert's. And sometimes there's a genetic tendency to that. Most of the time we just don't know why. But it's usually not a serious condition as long as everything else looks okay. I'm just not sure about the enlarged liver and spleen, especially if all the other blood counts come back normal. So maybe it just will take some, follow-up just to kind of take serial measurements. And if he's feeling great, it's probably not going to be anything worrisome. But again, I say that not knowing the whole situation, especially with that, what it showed on the ultrasound. So I'm not sure to tell you that, but Gilbert's is something that we see a lot of, and it doesn't mean a lot.
Danny, thank you for asking that question and being with us as always on Tuesdays. Let's get to Cindy here. Thank you, Cindy. I have SIBO and I'm being treated for it with meloxicam or Celebrex for my severe arthritis make my stomach problems worse. I take the Dr. Rogers pain formula, but need something stronger. What's your thoughts on this for Cindy?
SIBO stands for small intestinal bacterial overgrowth, and there's usually different kind of treatments. I think Robin Riddle did a great job with talking about that in one of her podcasts. I'm pretty sure she did.
She did.
But certainly the non-steroidal anti-inflammatories can upset that gut microbiome, so it could be making your problems worse. Again, the pain formula is good and it shouldn't upset your stomach. But I would definitely add Digest Shield to it and take care of your SIBO. There's a lot of different treatments, too long and complex for this short Q&A, but it definitely should be treated. And there's some pretty good natural treatments that Robin talks about with SIBO. And some different kind of diets you can go on, but definitely get on Digest Shield. That should be a staple for anybody with that.
And Cindy, I'll say the best way to find that video that Robin did, if you search for SIBO Robin Riddle or SIBO Performance Medicine, it'll show up on YouTube. And it's the Explain This episode on SIBO where she does go into the more of the natural treatments for it. So thank you, Cindy, for that question. I hope that helps a little bit. All right. If you have a question, put it at the end for me. I know I've probably missed one, but I hope I haven't. And if we don't get one in the next minute or so, we're going to let Doc get on his way. I'm going to try and get these dogs up here for you. I know you're anxious to see them.
I'd love to see them, but if not, I understand.
They're
Ben,
busy.
I had the best dinner tonight. I went down to the local seafood market and bought some of these things called stone crabs. Have you ever eaten? Anybody out there ever eaten a stone crab?
I have
It's
not.
they're only in season for a few months down here, down in South Florida. There's a place called Joe's Stone Crab. It's famous and
I've heard of that.
that I've been to, but I also saw one in Vegas one time. But in any event, this place was a local seafood market that actually Scott Fitzpatrick told me about. But they're just wonderful stone crabs. So I don't know why I told you that, but
Well, apparently it was really good. If it's performance medicine show ready, I mean, it sounds like we all need to partake.
Other than medicine, like good food.
Katie, it was so good to see you today. I see you out there. Thank you so much, Lauren. I see you. So good to see you. Lauren loves seafood. I'm warming up to seafood. It's never been my go-to. I'm a meat and potatoes kind of guy.
The stone crabs reminds you of Alaskan king crab legs, except better.
Okay, that makes sense. It makes sense. What are you gonna do the rest of the night? You gonna chill out, take a walk?
I'm going to watch the Olympics, take a walk, watch the Olympics. I love watching the Winter Olympics. You know what I've done too? I like the pairs ice skating.
What?
That sounds crazy, but I thought I'd really want to watch, the slalom, the skiing, all that stuff. But I'm really enjoying the ice skating as much as anything.
I need to take a poll. We still have some people with us tonight. What has been the event you love the most? I know, the downhill skiing is super fun. I know
I like
that
watching the quad god, Ilya, who's just incredible ice skater. I mean, he's doing things like he's doing 7 quads in one routine. Nobody's ever been able to do that before.
How do you know all this?
Doing it from a Lux position. He's doing a quad sow cow.
How do you know this language?
Oh, loops. I mean, he's doing sow cows and edge jumps. As you can tell, I've been educating myself on
That's so funny. Ivy's into the ice skating too.
It's just beautiful. Plus,
it is beautiful.
The pairs dancing to me is just incredible.
I
Think about it, dancing. I never have liked watching people dance just on a dance floor. It never,
yeah, I'm with you.
never got much out of it. But when you're on ice and you can glide and jump and throw your partner up in the air and hold them in a death spiral, going around in circles. I mean, it's just pretty incredible. It's just magnificent, man. That's what I'm trying to tell you. Watch it. You really get into it. It's beautiful.
Has curling happened yet?
Yeah, I watched the curling today too.
Okay.
I know I'm supposed to be studying down here most of the time, but I did watch the U.S. got silver. They just got bumped out on the last shot, as a matter of fact. Curling looks like shuffleboard to me.
It does.
It's shuffleboard. I don't understand, where the brush is. But apparently when you brush the ice, it makes it slicker and the thing goes further if you're trying to get it. You can also make it kind of move in one direction. I guess that's why they call it curling, by brushing the ice from one side of the track you're trying to get it to. It's pretty cool. I mean, you learn stuff about these Winter Olympics that you just don't see much of. So it's kind of fun.
I'm watching the documentary on the U.S. hockey team. I think it was what year was that? 1980?
Yeah,
in Lake Placid.
Drizzle on ice. Yeah,
Yeah. And that's really interesting.
yeah. He was the taskmaster. Herb Brooks was the coach, apparently.
I'm gonna put this up from Danny. Thank you, Danny. Has an appointment with the GI specialist in May. Okay, thank you. That's perfect. Thank you.
Good.
Thank you for putting that in there, Danny. All right, Pop. I appreciate you doing this. I don't think the dogs are gonna. I don't think they're probably busy. You know, they're taking advantage of the parents being out of town. You know, they're probably having a party. They got so much going on. But thank you so much. Thank you, TK. Thank you guys so much for being with us tonight. Y'all mean the world to us. We have so much of our team in here. We have friends in here. Thank y'all for hanging out. Stanford's curling. There we go, right up there with the puppy bowl. I love it. Thank you guys for doing this with us. We'll be back next week as always. Doc will be in person with me. We'll be doing we do this every Tuesday, 7 to 8. Thank you, Diane. Motaz was in the building tonight. Motaz, what's up?
I bet Motaz is really freezing up where he's at.
I bet.
Motaz is 76 degrees here and sunny. You should move down here.
There you go. Diane, thank you. Jack, thank you. Jack's got a new puppy. We'll be thinking about you, Jack. But isn't that so much fun? Just, you know, those new puppies are the best. Shelly, thank you so much. Lisa, thank you so much. Lauren, thank you. Lauren's saying safe travels. Motaz is saying it's 6 degrees where he's at.
Oh,
all right, Pop. Thank you for doing this. I love you.
Thank you, man. Love you too.
All right. See you guys. We will be back next week. Thank y'all for being with us. As always, we will be back Tuesday, 7 to 8. Searching for my outro. We'll see you guys.
Don't go away.